One of the key benefits of the Welsh Nursing Care Record has been the amount of time that's been saved by nurses and that they can then release that time back into care.
I'm especially proud that Cardiff Vale is live and that every health board in Wales is using the application on their relevant wards.
The Welsh Nursing Care Record has been a huge change for nursing across Wales. It's probably been the biggest professional change in the last 30 years.
Some colleagues were really anxious about using the system because they felt the change in practice would be so great. Since we've rolled this out, they've really taken to it.
I found the move from paper to digital quite easy. It was something that I was passionate about, but some of my staff did find it more difficult. They had fantastic support from Swansea Bay Health Board and also from Digital Healthcare Wales, and now the staff would never go back. They all say they don't know what they did before they went digital.
The great thing about this system is that because it's inputted electronically, there's no issue with understanding handwriting and everyone can understand everything that's on there.
There's definitely a more seamless transfer of patient records now upon transfer, so whereas previously would be waiting for physical records to be transferred, that now comes across electronically, so it's instantaneous.
For a long time now, health boards have been working together to standardise how we record care and cut down on duplication, and the Nursing Care Record has played a big part in making that happen.
The system has improved greatly since it was first introduced. The ease of the use, everything there at a touch of a button. We're able to filter words from entries inputted by other people who use the system to find out what was given in the care at that time. We're able to find patient telephone numbers, weights, everything. It's just there at a touch of a button, making our lives easier.
I think one of the things that we hadn't quite realised is how rich the data would be that we got out of the system and how we can use it in many, many ways.
When I qualified as a nurse, not that long ago now, everything was on paper, and as someone with a diagnosis of dyslexia, I found that very challenging. When I'm writing, my thoughts go off in lots of different directions, so the ability to edit them as I go along in a digital system makes a huge difference.
The significance of the Welsh Nursing Care Record for medical examiners is that they can very quickly get to important information that may have been recorded by a nurse at the time of the death of the patient. And that's absolutely critical for their decision making about what they do next.
I think we now need to look at our Welsh Nursing Care Record, see how it's evolved since we started using it, and engage with our users and patients as to where we go next and how we can make improvements to make it even better.
Moving forward, the next part of the Welsh Nursing Care Record journey is to utilise the data to understand patient outcomes and any improvements that we've been seeing, but also to inform the nursing research to support evidence-based practice.
As chair of the programme, I'm really excited about what comes next. We'll be adding more content as we move towards fully digitalised nursing records, helping us to work more efficiently and giving our teams the digital tools they need to provide the best care possible.
I'm delighted that the Welsh Nursing Care Record has been rolled out across Wales. For our nurses on a daily basis, this will make such a huge impact on how they work, it will release time to care, and I really think it will improve the safety and quality of care that is delivered.